A 3-day-old infant is diagnosed with hyperbilirubinemia. A bilirubin test is required by capillary heel puncture. The nurse does all of the following except dash. A. Using an antiseptic wipe to cleanse the foot. B. Squeezing the infant's heel while collecting the sample. C. Wiping away the first drop of blood. D. Turning off the bilirubin treatment lights before collecting the sample. E. Applying heel warmers to increase capillary blood flow. The answer is B. Squeezing the infant's heel while collecting the sample. Avoid squeezing the infant's heel if possible. Squeezing causes hemolysis of the specimen. Too much pressure may also result in damage to the tissue. Turning off the bilirubin treatment lights is also important because exposure to the light may alter the bilirubin in the sample. Cleansing the site of puncture is important, and warming the area will increase the capillary blood flow. A mother brings her child in for paroxysmal bouts of 10 to 15 coughs followed by 1 to 2 deep gasping breaths. It started as a simple cold and cough, which seemed to be getting better before the gasping paroxysmal coughing started. The coughing is severe enough that he has vomited several times. What is the most likely diagnosis? A. Pertussis. B. Croup. C. Bronchitis. D. Pneumonia. The answer is A. Pertussis. The most likely diagnosis in this case is pertussis, also known as whooping cough. This is caused by Bordetella pertussis, a gram-negative encapsulated coccobacillus. It begins as a seemingly normal upper respiratory infection, which progresses 2 weeks after onset into paroxysms of 5 to 15 violent coughs followed by a forceful inspiratory gasp, often described as a whoop. Coughing is often forceful enough to induce vomiting, nosebleeds, or subconjunctival hemorrhage. Croup, pneumonia, and bronchitis are all conditions that include cough, though none of them will generally present with this degree of gasping, vomiting, or blood vessel damage due to cough. Strawberry tongue and maculopapular, sandpaper, rash are commonly seen in what childhood exanthem? A. Scarlet fever. B. Varicella. C. Impetigo. D. Roseola. The answer is A. Scarlet fever. Strawberry tongue, glossitis, and maculopapular, sandpaper, rash are commonly seen in scarlet fever, a condition caused by group A Streptococcus bacteria, often after a bout of strep throat. The other exanthems listed can all cause erythematous rash, though none are associated with glossitis. Parotid gland enlargement, fever, myalgia, and tender salivary glands would indicate which of the following conditions? A. Rubella. B. Measles. C. Mumps. D. Herpes angina. The answer is C. Mumps. Parotid gland enlargement, fever, myalgia, and tender salivary glands are all indicative of infection with the mumps virus. Symptoms typically last for 7 to 10 days, though sequelae such as hearing damage and testicular disorders can be long-lasting or even permanent. A nurse working in labor and delivery is responsible to assessing a newborn according to the Apgar scale. The newborn infant is noted to have a vigorous good cry, a heart rate of 97, with good reflexes, and acrocyanosis. What is the newborn's Apgar scale according to these findings? A. 8. B. 9. C. 7. D. 6. E. 3. The answer is A. 8. The Apgar score is 8, the child has received a score of 2 under respiration for good cry, a score of 2 under cry reflex for vigorous crying, a score of 2 under reflexes for good reflexes, a score of 1 for heart rate of 97, under 100 bpm, and score of 1 for color for acrocyanosis, blue limbs, pink body.